Hello, I'm Emily Weaver and I work as an RN in the emergency room, and I've chosen to share on the issue of overuse in the emergency room. According to the CDC, there are 136.9 million emergency room visits in the U.S. in 2016, and only 9% of those required admission. According to the Maryland Healthcare Commission, as referenced by O'Shea, around 40% of the visits to the emergency room are considered non-urgent, and this is found to be similar around the United States. As you can probably guess, this can cause many problems for patients, nurses, and the society. The objectives for this presentation are to determine 3 causes of emergency room overuse, identify 3 ways overuse of the emergency room hinders patient care, and identify 2 ways that emergency room overuse can be combated. There are many different sources for overuse of the emergency room. First of all, according to O'Shea, emergency rooms are required by the Emergency Medical Treatment and Active Labor Act, or EMTALA, to provide care to all people seeking help, whether they are able to pay for the care or not. This causes an increase of patients who have no health care coverage, or those who do not have money available up front to seek out treatment from the emergency room rather than a doctor. Another reason people may choose to use the emergency room in a non-emergent situation is due to operating hours that are available at their primary care provider's office, as Gorder states. The hours are not practical, or they have limited availability for appointments that some people cannot fit into their schedule. Those with mental illnesses often find themselves in the emergency room during a crisis. Then they are transferred to another more equipped hospital after their initial assessment, according to the CDC and Gorder. This is not necessarily considered unnecessary, but rather overuse. There is not much funding for those with mental illness. Only about 7% of the budget is allocated to mental illness, while about 25% of the population suffers from this type of illness, according to Gorder. In a study done by Haber, Wensky, and McCall on the elderly needing to be sent for unnecessary or preventable emergency room visits, it was found that 33% did not have a single visit with their primary care provider or specialist in 60 days. This brings us to the issue of prevention. In some cases, steps of prevention are not taken, ending up in another emergency room visit. There also seems to be a misunderstanding throughout the population about what an emergency actually is and when a visit is needed. As noted by DeVry and Oza, many people believe that they require immediate care, when in reality, their issue is non-urgent. So what kind of impact does this have on nursing? For one thing, it causes burnout. According to O'Shea, the intensity and deteriorating work environment can cause nurses to feel worn out, stressed, and unhappy in their positions. In some cases, nurses may be required to work mandatory overtime to cover shifts. In my opinion, this is one of the most dangerous things that can happen to a nurse. Having the wrong mindset can put patients in danger due to fatigue while making decisions and stress causing less sharp-minded providers. This leads into the next piece of nursing shortage. This is another big effect on the area of nursing. O'Shea notes burnout along with other factors causes nursing shortages. This is a big deal, especially since emergency rooms are attempting to increase their capacity due to higher demands. This is just a downward spiral of attempting to hire and retain nurses, while fatigue and burnout from higher censuses are causing the opposite. Another thing that affects nursing from overuse of the emergency room is training that is received. Due to increased amounts of patients who have non-urgent issues, those who are on orientation are getting less of a chance to be in critical situations with an experienced preceptor. Because of this, we are endangering future patients as well as nurses that will be trying to care for them. How does the overuse of the emergency room affect healthcare and society as a whole? Initially, patient safety is compromised. In some cases, overfilled emergency rooms will have to divert ambulances to other hospitals. This can delay care for those who need immediate care, as noted by O'Shea. There is a higher cost associated with treatments in the emergency room. This is true for those who have insurance and also for the taxpayers. Due to some costs not being paid by patients, hospitals require refunding with taxpayer dollars for the care they provided, as stated by O'Shea. This causes strain on the entire system. It leaves insufficient funding for other programs to aid in prevention and physical recovery, according to Thwaites, Glaspie, and Lemire and Littlechild. Another impact on society due to overuse of the emergency department is that if a severe outbreak or pandemic such as the flu were to occur, there is no way to accommodate all of the needs of the patients, says O'Shea. How can we fix this? For one thing, we can encourage provider and patient relationships. This can help with primary and secondary prevention, resulting in more controlled medical issues, as noted by Haber, Wensky, and McCall. Telemedicine can be used and implemented in more settings. This fosters that 24-hour care that some people need to fit their schedule. Another thing that can help to solve this problem is to divert patients who are deemed non-emergent to other care facilities, such as primary care provider or urgent care centers. We can extend office hours at primary care providers and specialist offices, helping to make room for more patients. All in all, emergency rooms are overcrowded and overused. They see many patients with non-urgent medical problems. This causes distress on staff as well as the patients involved due to longer wait times and delayed care. There are many ways we can start to combat this problem, and I anticipate many more ideas to surface. At this point, education is key, and getting the word out about the problem and giving solutions rather than just complaining. Together we can make a difference and continue to provide that emergent care that is needed to all patients who arrive at our door.